this is Dr. Larson with the Next Up Foot and Ankle Clinic. Today we wanted to discuss something that we commonly see in our clinic, which is nerve entrapment. Patients often don't understand this very well because they come to see us with neuropathy or nerve pain that could be isolated to just one leg, one foot. But what we find is when the nerve gets pinched, it tends to mimic neuropathy like patients with diabetic neuropathy. Now, nerve entrapment can come from various things. It can be high levels of blood sugar that cause the nerves to swell. It can be damage or impingement of the nerve in the back that causes the nerve to swell up downstream. It could be thyroid issues. It could be trauma. There are lots of different things that cause nerves to become pinched. The biggest thing that we see is the anatomy where nerves have to travel doesn't change too much. So when the nerve swells, that tends to cause issues that make the nerve lose blood flow, that can cause it to have ischemia or dysfunction. So what we do in our clinic is we use ultrasound, and we use that to visualize the nerves and to see. Also, we do a pretty thorough assessment as far as the nerve function on the sharp dull sensation, your pain levels, and we look for provocative signs or pain at the areas where these nerves travel through their tight tunnels. With that, we can use ultrasound-guided injections to really diagnose and treat neuropathy or nerve entrapment. What we tend to find is that if you have good results from the injection, that you can undergo a procedure called nerve decompression. We do this in various locations, including up just distal or just past the knee, down to the foot where the tarsal tunnel, or in comparison to the carpal tunnel, you can find the nerves pinched as well. The neat thing about these procedures is the recovery is relatively quick. What we tend to find with them is the nerve is pinched and it tends to swell up after we release the tight tissue from it. It's a very rewarding procedure. I love doing these because my patients tend to be very happy. That nerve pain can be something that's detrimental. It can hurt all the time. After activity, during the night, it often wakes them up in the middle of the night. I had one patient who had pain that she had 1 day relief from the injection, and after her surgery, she was able to have relief consistently. And that all comes from just taking off the tight tissue from the nerve. Now, this procedure is done in, again, various locations on the leg and the foot, but the recovery tends to be about 2 weeks, and most patients can walk. We really, really love this procedure here, and it tends to do a lot of good for our patients.